I growed up all around, around Owensboro all my life. I used to farm till I went broke, and then I started just raising tobacco and worked up there at W.R. Grace for 30 years. And now just about what I have to do. Mow the grass, take care of a little garden, get my wife up in the morning, put her to bed at night.
When I got out of high school, I went into the Marine Corps and was in there for almost 4 years. I was between Korea and Vietnam. I was one of the lucky ones. And got out of that and went into banking. Now I sit at home and do whatever I want to.
Palliative care is care that's designed to help aid in keeping the patient comfortable. That can be pain or other types of symptom management. They need to be seen more regularly than the physician can see them.
I like it when the nurse comes out because you can tell her how my wife's doing and everything. Yeah, they make you feel better when they come out.
Well, it just makes you feel better. It feels safer. They told me that I could call any-time. So when he couldn't breathe good one night and it's we didn't know what to do, I thought I'd try it, and I did. And even being in the county, they were here 30 minutes after I called.
In today's day and age, there's a big push for cost-effective care. And so one of the ways that we try to do that is trying to keep people out of the hospital and keep them out of the ER.
Certainly from a cancer standpoint, the overall amount of time that an individual has to spend in doctor's offices, infusion rooms, and radiation and imaging, it adds up to be quite a bit and quite significant. So I think that if there's anything that you can do to help triage the patient at home and to keep them from, all the hours they'd spend waiting and, waiting on results and things, if it's an issue that could be handled at home, I think you've really done the patient good.
When they are in palliative care, I still see them in the office or sometimes just by phone calls, and the care that they get is just superb. So they don't have to go to the hospital anymore, which is the greatest benefit to the patient and to the family in terms of taking care of them.
They ask me if I'm eating right and everything, and do I need anybody to come over and help me do anything. They're just more than helpful.
Of course, when we see patients in the office, we oftentimes get one story, but then when you actually see a patient in their home environment, there's other needs that come out that maybe the patient's not good at verbally expressing or relaying, but then somebody who sees them kind of in their native environment can pick up on. And so palliative care could really fill in a gap that without them is not, there is nothing else that fills that hole.